Hi, this is Dr. Bai from York College of the City University of New York. Today, I'm going to talk about our understanding of the learning needs of students with disabilities through our virtual reality-based storytelling platform. Here are some of our research goals. We'd like to examine how our students with disabilities respond to such a multimedia format, and we'll identify common themes in this process and discuss disadvantages and advantages of using virtual reality-based storytelling to promote learning. And we would like to recommend some practical instructional design strategies. Our research is based upon the literature of social constructivism, in which we believe that students learn through observing others and through co-constructing knowledge with others. In this case, they watch how other stakeholders play out the story and they learn together with them. And also, we believe the students can make a meaningful connection to their prior knowledge based upon authentic real-life scenarios that we displayed in this story. Here are some selected video scenes that our students were shown in this study.
I don't know why the doctor is so concerned about these pills. I am 80 years old already. I made it this far without these pills, and they make me have to go to the bathroom so often. It is really annoying. And I am not letting any nurse come into my home and tell me how to live my life.
Having tea, her friend notices that Mrs. Bowman's speech has become slurred. 5 minutes later, Mrs. Bowman developed a right facial droop with mild right-sided weakness. She was transported to a local hospital's emergency department via ambulance. The acute initial symptoms began resolving in approximately 15 minutes while en route to the hospital. Upon admission to the ER, Mrs. Bowman was noted to be disoriented, aphasic, and had profound right-sided weakness. The doctor is testing for facial palsy.
Please raise your eyebrows. Now, please show me your teeth. Now close your eyes. Next, please squeeze my hands.
The doctor is now testing eye gaze and visual fields.
Follow my finger with your eyes.
The doctor is testing leg motor function.
Now I'll raise each of your legs. Please try to keep it in that position.
A stroke patient must have a complete CT scan within 25 minutes of arrival. The computerized axial tomographic scanner combines a series of X-ray views taken from many different angles with computer processing to create cross-sectional images of the brain called slices. The CT scanner views how the brain looks, works, and gets its blood supply. Once Mrs. Bowman is discharged from the rehab facility, she will need assistance at home. She will need someone to assist with her ADLs.
Some positive findings from the studies are our students have found the video visually appealing. They are interested in watching the video. They reported it's like watching a TV series or documentary. And also, this helps them identify the feelings and concerns of the stakeholders, such as patients, to develop sympathy, and the voices help grasp their attention so that they are engaged in the learning process. And also, some graphical details, such as moving mouth or drooping face or shifting eyes during the exam, help them understand the scenarios better. Our students also shared some suggestions and concerns from the study. A couple of students reported that they felt bored 6 or 7 minutes into the video, so this is something we need to take into consideration as instructors or researchers, so the overall learning duration should be considered. And also, because of the lack of understanding of the domain knowledge, a lot of jargons or medical terms seemed overwhelming for some students. So other visual clues, such as the verbal hint or the explanation of some medical terms or the pace of the learning scenarios, should be adjusted accordingly based upon the students' needs. That is our pilot study for our students with disabilities. We plan to have follow-up studies recruiting more students to understand how students benefit from such a multimedia format and how we can design our intervention in a more effective way. Thank you for your time. And if you'd like to see the overall virtual reality based story, you can find it from this QR code.